Okay, so today I'm going to be talking about anesthetics, local and general anesthetics. Okay, so we're gonna define basically. ما فيها description, just define. ليه بنقول local, ليه بنقول general. I'm sure you know it, but types of anesthesia, and we classify them. What are the drugs under local and what is under the general anesthesia? Then their mechanism of action. Now it's a bit complicated, but we're going to make it as simplified as possible. For local, it's pretty clear. For general, there's still gray area, big gray area, but we're going to, whatever we know, we're going to state it. And then we're going to be talking about certain pharmacokinetics and potency. We're going to talk potency, but under a different name. Okay, so before I move on, this is Dr. Samah. Dr. Samah is our new pharmacologist. She's joining the Department of Pharmacology in Al Faisal. She's going to be giving you lectures, and her specialty is neuro. Yani, she's going to be really of benefit, and she's going to contribute a lot to the College of Medicine, inshallah. So
it's nice meeting you.
Okay. Type. So advantage and disadvantage and adverse effects of local and general anesthesia. يلا نبلش. نفس. Okay. Okay, so anesthetics, interestingly enough, when we divide local anesthetics, we divide them on a structural level. We say amides and esters. But when we speak about general anesthetics, we cannot, because they're diversely structurally different. And so we say, okay, we're going to divide them. We have to think a way how to divide them. We decided that, we give some intravenously and others inhalational. Okay? So because before you mix up, it's just being smart, how to كيف الحال؟ تمام؟ نعم. Put it on. I don't mind. Oh, and I freak out when I see how I look like. That's it. And other than that, so I don't see myself. Very good. I like that. Yani, listening to my voice and looking at myself is two terrible things. Okay, so this is the start. So when we say local, and I'm going to start with local, basically because they found that these two groups of local anesthetics have similar structural categories, and that's why they said, oh, that's easy. One is amide, one is ester. Okay? No, it's not moving. What happened? Hello? Okay, now. So local anesthetic, from the word local, it means there's no loss of function, loss of consciousness. Okay, even the epidural guys, even in delivery, sometimes they don't call it local. They try to be more sophisticated. They say regional anesthetic because it's a big region that's being anesthetized, but still the consciousness is not impaired. Okay, so local anesthetics produce loss of sensation to pain in a specific area of the body without loss of consciousness. Okay, we can say topical. Okay, I'll add more topical. So epidural is a type of a local anesthetic or regional anesthetic or anesthesia. Right. They basically block nerve conduction. So now you know the mechanism of action, right? Because we're going to be a little bit sophisticated when we describe the mechanism. So mainly what? The sensory impulse, which is the afferent, okay? And in higher concentrations, it might even block the motor impulses from the periphery to the CNS. Clear? Now, this is it. This is the structure of local anesthetics, the two groups, right? So examples, procaine and lidocaine. In lidocaine, we have amide. In procaine, we have ester. Now, just from the beginning, ester can lead to more allergic reactions than lidocaine or amides. So ester groups of local anesthetics might lead to more allergic reactions. Okay, I'll tell you why. Because if it's metabolized, so let's see. First of all, they are all lipophilic. This is a good characteristic. We need it to be lipophilic. One. Two, we need it to be weak base. Most of them are weak bases. Okay, they share the common structure theme. Look, we have a tertiary amine on the right. يعني إحنا هون. This is a tertiary amine. Here we go. Here, either we have an ester or amide. This is the amide and this is the ester, and the aromatic group. This is it. Easy. So again, tertiary amine is in common between two structures. The ester or amide, this is the different thing, and the aromatic, they're all there. Okay. This basically is the mode of metabolism. For ester, it's the cholinesterase. Cholinesterase breaks it up. Plasma cholinesterase, it's an enzyme. For the amides, it's basically by liver. The liver and the enzymes in the liver is the ones that are responsible for metabolism. Okay. Now, if you look here, one of the esters is cocaine. You know, the drugs that we all use. Okay. So it's interesting because it's a stimulant, right? It's a stimulant. At the same time, it can be a local anesthetic. So it has a sympathomimetic activity, okay? But don't get misled because it has a local anesthetic activity from, this is the only natural local anesthetic. The rest is chemically modified, okay? Clear? So what they have done is they have modified the rest structurally to make it less sympathomimetic, less stimulant, less addictive. Clear? Okay, so that's the ester part. So let's discuss mechanism of action. Now, the variation is basically in pH, لأنه عم نحكي weak base. The pH has to be there. Then lipophilicity and the morphology of the nerve. يعني the narrow nerve, the shorter axon is going to give me more, is going to do the effect more, right? Right. So mechanism of action basically makes sense. If I'm giving a local anesthetic, I want the action potential dependent sodium channels in excitable tissues. Okay, so I said that these molecules can cross the membrane. Here we go. Cross the membrane. Here we go. This is the went through the nerve or the neuron, I'm sorry, transmembrane through the no carrier, no nothing, because it is lipophilic. Okay, highly lipophilic. The more lipophilic, the better. Now, what about the pH? It seems that the intracellular environment of the neuron is more acidic. Okay, what would that do? What would that give what would that make of that drug that I am introducing? Make it more charged, which is going to make it more difficult to get out of the cell. So it will be focused inside, intracellularly. Now what? It will bind to the sodium channel from the inner domains. Okay, so now we can see that here clearly. Here is the, so here is my molecule, is my local anesthetic. It will become more charged, binds to the inner part of the sodium channel as if we are doing inactivation to the sodium channel. Okay, and we are here blocking the entry of sodium ions and decreasing the action potential. Kabish? Yeah. So slow depolarization, block impulse propagation. So what is the factors? What are the factors? Tissue pH, nerve morphology. مش any nerves it can bind, it can block, right? Large diameter nerves, maybe it's going to be more challenging to block, right? Depends on the concentration. High concentration, probably more chance. And lipid solubility of the drug. So you know this is the fiber type. When we have a smaller diameter, the sensitivity to the block is going to be more, and it shows here in the pain, the type C fibers. Okay, so when we compare the types of local anesthetics, you will see, now the cocaine, we said they are the only anesthetic.